the death of Shefali Jariwala. Mystery surrounds it as police sources are telling us that Mumbai police suspect that the deceased actor Shefali Jariwala was taking heavy doses of anti-aging and multivitamin treatments, and there were skin whitening medicines as well. There was also glutathione for many years, and this was without supervision of a doctor, raising several questions as to whether this could have been a case of self-medication. She also suffered from epilepsy, viewers, and we are waiting for the post-mortem report to also come out that will identify the causes of death very clearly. Doctors suspect a sudden drop in blood pressure may be the cause of Shefali Jariwala's death. Police have ruled out any foul play in the actor's death, and the post-mortem report, of course, will give us the final details of it. And a quick update in terms of what all could have really happened, viewers, because when we talk about Shefali Jariwala, it is symptomatic of what the entire Bollywood, to a large extent, a lot of people in Bollywood face, which is the ageless trap. The reason why a lot of these anti-aging treatments are being taking place is because of the pressure to remain young, look young, and also the vanity vial that many people have been talking about, that glutathione is actually something that is used for medical purposes, but people are now taking it for skin lightening, for anti-aging. That's a vial that should not be used without supervision. Next, the Botox blackout. Again, the rampant usage of Botox without adequate medical knowledge or supervision is being seen as another wake-up call for people in Bollywood, in showbiz. And last, the pharmacy roulette, where a lot of people are turning in to self-medication, going and using over-the-counter medicines. This roulette and all four of them together may not be the causes in that order as far as Shefali Jariwala's death is concerned, but highlights what many in Bollywood face in terms of why they resort to this. And that's why this is a wake-up call as to how young celebrities, reality stars, resort to this in their ever-rising ambitions to become relevant and stay relevant in the industry. Let me now go straight across to Abira, who joins us live to talk more on this. Abira, you know, this case has been a wake-up call, so to say, in terms of what all young Bollywood celebrities and reality stars resort to, extreme cases that they resort to because of the high-pressure demands of the job. You've been working the phones the last 48 hours. What all have you picked up in terms of the latest that's coming in, the shocker that is sent out to the entire industry?
Okay, let me break it down to you in points. First thing, that of course we all know this, self-medication. That is one thing. People are doing self-medication. Shefali did do self-medication. Second thing is obsession with how you look. We understand that you are supposed to look a certain way, but mindfulness and trying to understand your body from within and giving some food to your mind is very important. And it is not bad to go through these anti-aging, whatever you feel like, to look good. It's not at all bad, and we should not label it as something evil. It's not evil, but we spoke to a psychiatrist, Dr. Harish Shetty, who told us there's a very thin line between getting it done just because you want to get it done, and there is a thin line on the other side is obsession. So a dermatologist or a plastic surgeon should always have a psychiatrist in the same cabin when they are talking to the patient. The person, psychiatrist can figure out, is this person really obsessed? And dermatologist or a plastic surgeon should not take clients just like that because they are getting paid for it. They always should first refer them to a psychiatrist, get it from a psychiatrist in written that she doesn't have a certain disorder, because there are a lot of disorders when it comes to the way you look. I will not give you the names because again I'm not an expert, I might make mistakes, but there are a lot of disorders that are related to body image, and that can happen to anybody. And like he said, there are young girls who come into my office when they're 18 or 19 and they say we are overweight and we want to lose weight, and he's like, they're 46 kilos. So I have to mentally treat them so that start looking at themselves they have their view of themselves change. So yeah, these are the points, and self-medication is extremely harmful. Doesn't matter if it's a psychiatric medication or a medication or a dermatologist. Any kind of self-medication can be really harmful and have side effects.
Indeed, and that's what we just pointed out. The pharmacy roulette that we're referring to is just that, that concoction of getting everything and doing it yourself without any medical knowledge, supervision whatsoever. Abir, I'm going to leave it there, and we're going to keep coming back as and when, viewers, we have details of the post-mortem report that we are awaiting. And while we do, let's quickly now play out this soundbite of neurologist Dr. Rahul Chawla on some of the symptoms that my colleague Abira was talking about.
Patients who have epilepsy may have sudden unexpected death, and this is more common in patients who are not taking their anti-seizure medications properly, or those who have uncontrolled seizures despite treatment. So death is not that much of a rare phenomenon. It can actually affect 1 in every 1,000 epilepsy patients per year, and the risk increases by 6 to 9 times in those patients who have uncontrolled epilepsy or those who are not taking proper anti-seizure medications. Regarding IV glutathione and IV digoxin drips, well, first of all, they are not guideline recommended. They have no proper RCT or high quality of evidence showing any effect whatsoever. They do have their harmful adverse effects, including cardiac conduction abnormalities, arrhythmia, hypotension, and even anaphylactic reactions. There have been multiple case reports wherein patients have died after taking those IV detox drips, and probably anaphylactic reactions or sudden collapse or sudden hypotension were the reason behind those deaths. But still, we cannot directly correlate any sudden cardiac death in a person with the history of having glutathione or detox drips. One thing that needs to be remembered is that any supplement that seems too good to be true, that does not have RCT or meta-analysis level of evidence, is not recommended by guidelines, has potential adverse effects, should not be used.
All right. In fact, let's get in more voices from the medical community. My colleague Mara Shakil spoke to an eminent panel of doctors that included Ishi Khosla as well, among several others, regarding the many questions that continue to remain as far as Shefali's death is concerned and the killer pressures of looking young. Listen in.
Does nutrition get impacted when you take anti-aging medicines? Because it is being said that for skin glowing treatment and other treatment that she was undergoing, she used to take those medicines. Does body nutrition get impacted because of that?
First of all, I just say it's very tragic to lose a young life like this, and in these circumstances. The thing is that first you need to know what was the anti-aging treatment. Was it something new that she took? Because according to the reports that one is seeing, she has been taking them for 8-9 years. And so something as like a toxic reaction to something is unlikely because she was used to taking it. However, what seems more plausible is the fact that, I'm not a detective and I'm not trying to do that, but essentially she was fasting and she may be having some kind of an electrolyte imbalance which got exacerbated with the treatment or the injection that she took, and maybe the fact that she was also on anti-epilepsy medicines, which could have a reaction. And so whether it was fasting and a combination of the medicine, well, we really don't know exactly what was the content, but if it's a usual glutathione or vitamin C, they're usually pretty harmless and they're supportive to health and detoxification. But how they interacted with the fasting state or her existing epilepsy medicine, or was there a lack of epilepsy medicine, she didn't take her dose, we don't know.
Yes, so but that particular thought of glutathione and other vitamin C treatment that girls usually undergo after a certain age, it's become very commonplace, Dr. Kriti. Does it actually impact health conditions when you are fasting?
Definitely it can. We cannot say for certain what has happened and what did not happen in this case, but glutathione in itself, it's very important to know the right dosage in which it is given and the frequency at which it is administered. So glutathione again is a speculation. There are also anti-aging treatments with nicotinamide, which is commonly known as and marketed as NAD plus drips. glow drips, health drips, anti-aging drips, these are the ways it is marketed. These are known to cause electrolyte imbalance. As ma'am rightly said, in a fasting state that electrolyte imbalance could be exaggerated. These, when not given in the right dosage.
But can they actually be fatal?
So, these medications can also lead to hypotension, which is a fall in blood pressure, or cause cardiac arrhythmias. And these cardiac arrhythmias, when there is an underlying arrhythmia, maybe it is not realized in day-to-day activities, but with this it may be exacerbated. Also, if she was or any other individual is on any other medications like hormonal medications, medications for hypertension, again this combination can prove to be fatal. Not very commonly, but rarely such cases may happen. So it is very important for a person to be aware as to what medications they are taking, and
So there are a number of drips which have come in the market.
Right, and a lot of people, because of the prevalence of social media, young generation, they just go to these wellness clinics and say, I want this treatment and I want so and so treatment, without knowing the repercussions. A lot of these places don't even have qualified dermatologists who are trained to administer such therapies. So it is very important to take a proper patient history to know what medications they are on, what lifestyle habits they are following.
So this mushrooming of wellness centers or beauty centers, Dr. Dipali, you also run one such beauty center. My question is, are they following the health protocols or the beauty protocols which are set? You know, in the sense that, are there doctors, cardiologists there when such drugs are administered?
Sure, Maria. It's a very sad death, of course, we all know. But the fact is that there is no proper guidelines being followed at a national level. Most of these drips are being administered by nurse, even of course at my center in New Delhi. And when I travel to Mumbai or some place like that, I do it myself. But if the nurse is administering, it has to be in the right dosage. Taking these drips on empty stomach is what the the American school is suggesting, because the absorption is more. So one can be fasting for about 6 hours, but it has to be in that case taken in the morning. So we really don't know which drip was administered. NAD drip can yet be uncomfortable. Glutathione can actually be taken empty stomach. But the protocol of the dosage has to be according to your height and weight. Your doctor should be involved in it. They are very, very safe, provided it's not a counterfeit product. It's not a duplicate product, provided the cold chain of the product is being maintained very nicely. How we have proper standards here. We do not buy duplicate. We have fixed dealers and distributors. But I think this is a wake-up call, and the Indian government must take stern action now and ensure that these duplicate products are removed from the market. Because interestingly, Maria, I get regularly young girls who have purchased these products without knowing the distributor from websites like Alibaba and India Mart, etc. And they have purchased it at very less cost, and they forced centers like us to inject. Being ethical, we always say no to them. And even some of them are ready to pay any bomb of money, but that's never lured us. But we don't know about centers where there are no doctors, where are those beauty clinics or wellness clinics which are not run by doctors or business people is the one behind it. We don't know if they are injecting such products, which could actually be very harmful.